Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Naha Abalada from Roots Community Health Center, reporting for the week of May 8th, 2023. Following an update on COVID, I'll talk about the ending of the emergency declarations, as well as an update on public health leadership in the United States. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. With the public health emergency declaration in the United States ending this week on Thursday, May 11th, a lot of shifts are happening in terms of the surveillance that we've been monitoring all this time. There was a morbidity and mortality weekly report early release just put out on Friday that goes into some of these details, and I've linked that in the post. I'm not going to review this in detail today, but a couple of things to note are that the maps, the community level map and the community transmission map, which I've showed here many times before, are going to be discontinued. There are a couple of more data sources that will also be discontinued, and others will be downgraded in terms of how frequently they will be updated. Some of them will go down to weekly or every other week, where before they were reporting daily. So it may take a little bit to adjust to all of the shifting here, but in general, it appears that the most important and reliable data that we'll be wanting to look at will include deaths, hospitalizations, sequencing, and wastewater. Case counts and percent positivity may become important if we see significant shifts or trends, but outside of that, the overall numbers of tests for most parts of the world are too low to be useful in a continuous way. So I'll continue to check on them and report on them when they are relevant. Taking a look at provisional weekly COVID deaths, and remember these do get adjusted once final reporting and documentation are received, but the provisional count for the week ending May 3rd, 2023 is 1,109 deaths. That's slightly more than the week before that, but still low compared to how we've been doing for the past year or so. In total, we've had 1,129,978 confirmed deaths in the United States from COVID. 35,217 of those were just in this year, 2023. And the lowest weekly number of deaths was actually the most recent one for which we have confirmed data, and that was the week ending April 8th, 2023. And this is the second week in a row where we've had all-time pandemic low levels. So that is some good news, although it's still too high at over 1,000 per week. These 2 weeks are the lowest of the pandemic. The next lowest after those 2 weeks were a year ago in April. So we know that April's a low month, but still grateful that the last 2 weeks for which we have confirmed data are the two lowest of the pandemic. Regarding hospitalizations, we do continue to see it trending down, although when I started to zero in on the data, I'm noticing that it's not looking too complete for many of the different areas. So we know that the requirements for the states to report to the CDC have loosened. So we're going to see how this all plays out. The state of California does appear to be continuing to update its data, and there are currently 1,236 people with COVID-19 who are hospitalized in the state of California currently. And it may be that we need to look at individual states now to see what their reporting cadence will be. So more on that as time goes on. Here in Alameda County, we are also trending down with 53 people with COVID in the hospital, 7 of those in the ICU. This is about our 4th or 5th lowest level of COVID hospitalization since the pandemic onset. So we'd like to continue seeing this coming down. A total of 2,232 people in Alameda County have lost their lives to COVID. Taking a look now at wastewater, we see that much of the country looks to be in the cooler colors, the blues, and those are the relatively lower levels of SARS-CoV-2. There are now 1,423 wastewater sampling sites. That's 20 more than what I reported last week. Not all of them are showing current data here. Those are represented by the gray dots. And out of the data points that I mentioned that we'll continue to look at, wastewater is the one with the most promise for giving us information in advance that we could act upon. Hospitalizations and deaths in particular are lagging indicators, meaning that they tell us more about what's already happened than what's to come. So I would say for those of you who are interested in this, especially those of you doing the work on the ground, like all of you community health workers and health educators out there, and thank you as always for your messages of support. But for you in particular, I would say it's important to drill down in your area. And if you have wastewater sites nearby, keep an eye on what's going on there in your local area. As time goes on, we're hopeful that we'll be able to translate this into opportunities to provide information and education to community residents about the levels of SARS-CoV-2 in the environment and what may be coming and what they can do about it. Taking a look at Oakland's wastewater, SARS-CoV-2 concentrations are looking a little flat, so we'll just continue to keep an eye on it. Looking at the nowcast variant proportions for the United States, remember these are projected proportions of variants for the country. We're still sequencing a rather small percentage of sequences overall, but based on that, they're able to do some modeling and project what they think is going on. And as you can see, we have a new color on the tracker. That's the pink color representing a new variant that just made it onto the tracker, which remember means that more than 1% of the specimens are projected to be this new variant XBB.2.3. Now, XBB.1.5 was up close to 90%, but it keeps on inching its way down. It's now down around 67%. And then XBB.1.16 and XBB.1.9.1 continue to creep up week over week. Remember, these are all Omicron subvariants, and they are all quite contagious. One seems to be a little more contagious than the next. But so far, we have no information about them being any more or less virulent, meaning they are not making people any more or less sick than their predecessors. And although XBB.1.5 continues to be dominant across the country, we do continue to have some regional differences in variant proportions. For now, there's not much to say about this other than we'll continue to see variant monitoring as a very important part of ongoing surveillance, because this can hopefully let us know when there's a more concerning variant, where it is, and maybe some early indicators about what it's doing clinically speaking. Is it making people sicker, and so on, and hopefully even give us some lead time to prepare. As I've mentioned many times here, the public health emergency in the United States is set to end this week, Thursday, May 11th. So what does this mean? Nothing magical is happening on that day to the virus, of course, unfortunately, but a number of emergency provisions that were in place will change. I'll give our best understanding of the highlights of this. First is that vaccines and treatments will continue to be covered one way or another, either through insurance coverage or through special programs for the uninsured. Now, testing is where things are going to look a little bit different depending on your coverage. If you have private health coverage, the requirement for your insurance company to give you free over-the-counter tests actually will end on Thursday with the end of the public health emergency. This doesn't mean that your plan won't cover them. It's just that they won't be required to cover them. So it would seem like it would still behoove them to cover over-the-counter tests, since it's a lot more cost-effective to detect and treat if needed than it is to have complications that might require hospitalization and so forth. So if you have private coverage, it would be worth checking in with your plan. You may even be able to order some tests before the 11th, and that would be great, but at least find out if they're going to continue to cover those tests or not, so you can plan accordingly. There should never be an issue having your healthcare provider administer a SARS-CoV-2 test, and those tests should be covered. But as I've mentioned, it will be worth checking with your primary care doctor to see if they are in fact doing COVID testing, since we know that not every office is offering testing. And if your office is not offering testing, you may want to ask why, or what happens when you get sick. Are they going to test for flu and COVID and things like that, which would be standard of care. But if they're not testing, you can also see if any of your local pharmacies are still conducting testing. For Medicare patients, a lab test by your clinician will be covered, but the over-the-counter test coverage will unfortunately end with the ending of the public health emergency on Thursday. If you receive Medicaid or Medi-Cal in California, there's a little bit of good news. Over-the-counter tests will continue to be provided free of charge through September 2024. The other notable change has to do with telehealth. Most telehealth benefits will be continued through the end of 2024, and with some possible exceptions like the provision of hospice support through telehealth that will likely no longer be covered. There are a few different nuances here. If you have a Medicare Advantage plan, things might also look different. But in general, most of the telehealth, including even some audio-only options if that's needed, will continue to be covered through the end of 2024. So that is good news. Now, we know that the end of the public health emergency is an administrative decision that marks the ending of several emergency provisions, but it does not mark the end of the pandemic itself. And by all accounts, there is still a lot of work to be done, and that work requires leadership. But the CDC director, Dr. Rochelle Walensky, has announced her resignation effective June 30th of this year, so not too long from now. And even though it appears that the White House was aware of this resignation, her announcement apparently came as a surprise to many leaders. They haven't named her replacement, and we are not sure what the transition plan will look like. And in addition to that, the White House is reportedly having some trouble filling an important new post, which is the director of the new Office of Pandemic Preparedness and Response in the White House. The purpose of this office is to serve like a permanent command center for COVID containment efforts, and also to help us be better prepared for future public health threats. I reported a few weeks ago on Project NextGen, which is a new $5 billion investment that was announced by the White House for the development of better vaccines and updated treatments like monoclonal antibodies, which we currently do not have available. And this effort would be led through this new office, but apparently they've been coming up empty and trying to find a leader for the office. I linked an article on the topic in case you are interested. But with the end of the public health emergency coming in just a few days, it's a little less than reassuring to have two top-level critical positions in limbo. So a fair bit of uncertainty here, and hopefully not creating too big of a vacuum or too long of a period without solid leadership, but we will keep an eye on that. In other news, the World Health Organization Emergency Committee on the COVID-19 pandemic held their 15th meeting, and the Director General agreed with the advice of the committee in determining that COVID-19 is now an established and ongoing health issue, which no longer constitutes a public health emergency of international concern. So remember, the public health emergency of international concern is the highest alert that the World Health Organization can issue to the world. And now they have declared that instead of being an emergency of international concern, it is an established and ongoing international health issue. So on the one hand, we might like hearing that it's no longer an emergency, but on the other hand, being an established and ongoing health issue is certainly quite significant. And the Director General had some wise counsel, so I thought I would take a few minutes to go through some words from him, Dr. Tedros. He says about the ending of the public health emergency of international concern, that does not mean COVID-19 is over as a global health threat. Last week, COVID-19 claimed a life every 3 minutes, and that's just the deaths we know about. As we speak, thousands of people around the world are fighting for their lives in intensive care units, and millions more continue to live with the debilitating effects of post-COVID-19 condition. The virus is here to stay. It is still killing, and it is still changing. The risk remains of new variants emerging that cause new surges in cases and deaths. The worst thing any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about. What this news means is that it is time for countries to transition from emergency mode to managing COVID-19 alongside other infectious diseases. If need be, I will not hesitate to convene another emergency committee should COVID-19 once again put our world in peril. While this emergency committee will now cease its work, it has sent a clear message that countries must not cease theirs. On the committee's advice, I have decided to use a provision in the international health regulations that has never been used before to establish a review committee to develop long-term standing recommendations for countries on how to manage COVID-19 on an ongoing basis. Important words from the World Health Organization Director General Tedros. So, in summary, we are in an unusual moment, and in some ways it's a bit of an unsettling moment. That's because even though the declarations and the emergency provisions are falling away, we're still contending with an evolving, mutating virus and an evolving situation. And amid that uncertainty here in the United States, we have a shift or even a possible lapse of public health leadership at the national level. So just when we are needing to make significant shifts and transition in a smooth way to be best prepared for the future, the leadership questions only add to the uncertainty. Thankfully, we are in a comparative lull with SARS-CoV-2, as we have been every April for the last few years here, and this is a good thing. But just as before, it does not mean to let our guard down because there is still quite a bit of SARS-CoV-2 circulating. And with the dropping of so many precautions and provisions, we are still seeing cases, we're still seeing outbreaks, and even in a lull, too many people are being hospitalized. Too many are still dying, over 1,000 people weekly in the United States alone. And of course, we would be wise to prepare for increases over the coming months. We are still learning about the effects of repeat infection, and we're still learning about post-COVID events and long COVID as well. What we do know is that if you caught COVID once and did fine, that is not a guarantee about the next time. So if you'd like to avoid a potential bad outcome or potential post-COVID or long-term effects for yourself and others around you, please do what you can to avoid getting infected or reinfected or spreading it to others. Gathering outdoors is always safer than indoors. If you will be gathering indoors, make efforts to improve indoor air quality, like adding HEPA filtration units, keeping central air running with a MERV 13 or higher filter, opening doors or windows. If you must spend time indoors with others, especially members of the public, wear a high quality filtration mask like an N95, a KN95, or a KF94, and limit your time in those high risk settings. Consider using rapid tests for pre-event testing. If you get exposed or if you have symptoms, conduct a rapid test every day or two while continuing to wear a filtration mask around others. If you or someone you spend time with unmasked would be treated for COVID, go ahead and get the more definitive PCR test as soon as possible to facilitate timely treatment. Remember, in general, you only have 5 days to start treatment, and the sooner the better. We could reduce COVID hospitalizations and deaths significantly if everyone who is eligible got treated. Please don't show up to work or school feeling sick and exposing others. Staying home and resting is best. If you absolutely must go out, a well-fitted N95 mask could keep you from sickening or even killing another person. If you're positive, please do an antigen test to exit isolation. In general, we believe that enough virus to detect is enough virus to infect. Also, please don't push yourself. Try to allow yourself the time you need to fully recover. And as always, remember to eat a balanced diet, incorporate fresh fruits and vegetables, avoid sugary drinks, consider a multivitamin supplement, get your blood pressure checked, your baseline labs checked, like your sugar, cholesterol, and vitamin D. Get some regular physical activity unless you're sick. In that case, please get your rest. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.